I actually wanted to be a teacher. I was going to school to be a chemistry teacher. I loved science. And I had a summer job that took me incidentally into a cath lab where a interventionalist was doing a neurology procedure on stroke. And I got to see them sort of inject that solution, and the brain lit up and saw all the vessels. And I was hooked from then on. I just thought the brain was the coolest thing ever and delved in with both feet. So I see adult patients, all ages, so some young, some old, some in the middle, women and men, any type of seizure disorder. But also a lot of patients who were not sure, that there's a question, is this seizure, is it not seizure? And then we have patients who have epilepsy that has been very bad, and their seizures have been very hard to control. So a lot of the patients that I see here are patients that were walking down the road to decide if there's maybe solutions for them that are not medical, so surgical options and that sort of testing that goes along with that, to go down that road and see if that's an option for them. One of the special things about here is we're a level 4 epilepsy center, which means a lot of times we get patients who have been managed with epilepsy at other centers, and they become refractory. They're not responding to medicines, they're not responding to the traditional treatments, and we're sort of wondering if there's this surgical solution. So we bring people into the hospital, record their brain waves, 24 hours while they're here, and actually capture their seizures. And it gives us a lot of information, both electrically what's going on in the brain and what they're doing during the seizure, which sort of helps us go on this initial journey to figure out where the epilepsy is coming from, because that's the first step.